Hello, my name is Eduardo Pleguezuelos. I'm the academic secretary of the Practicum Foundation, which is an institute of applied research in health sciences education in Madrid. I'm very pleased to share with you some details regarding an international multicenter pilot that we conducted in alliance with the European Board of Medical Assessors, consisting of the implementation of the clinical reasoning simulator Practicum Script as a formative tool for medical students. To put you into context, I will start by saying that Practicum Script is an online simulation-based program for self-assessment and training of clinical reasoning skills, as well as introducing the concept of uncertainty in medical education. So, the main goal of this pilot was to investigate the utility of Practicum Script as a clinical reasoning training methodology in undergraduate teaching and assessment. The motivation to develop this project were the growing demand for better assessment of medical student reasoning skills, particularly in uncertain situations, which is a very important requirement for new doctors from many accreditation bodies, and the very good experience we had before with the use of Practicum Script in postgraduate training. We ran the project in 3 phases. The first step was aimed at the development of clinical cases. The assessment material consisted of 20 clinical cases of internal medicine drawn from real patients. All cases were created by an editorial team from the Imperial College London, and they were validated by an international reference panel made up by 20 experts in internal medicine from 16 medical schools across Europe, the US, and Latin America. The second phase consisted of the implementation of Practicum Script by medical school for final year medical students, followed by the assessment of the student satisfaction with the program through a questionnaire survey. And in the final step, we performed the analysis of the data. The methodology of the simulation is grounded in the dual process theory of clinical thinking in decision making. So during the assessment and training activity itself, the participants were required for each clinical case to formulate up to 3 different hypotheses in free text format, assign them a level of probability, and justify their hypothesis by identifying positive and negative findings in the clinical case. Then, a student had to deal with 5 different clinical scenarios in which they had to decide how new information of the patient might affect the probability of their original hypothesis. And as you can see, the feedback was based on the level of concordance they had with the answers given by the experts and the expert justification for different decisions, along with some clinical evidence. We had 21 medical schools participating in the project, mainly from Europe, but also from the USA, Chile, Mexico, and Argentina. More than 2,400 volunteer students were enrolled in the pilot, and from them, more than 60% completed the 20 cases. We are happy to say that the overall level of satisfaction with the program was very high. Almost 90% of the students rated the experience as excellent or good. Most of the students evaluated Practicum Script as a good clinical simulation model for self-learning and relevant to their future clinical practice as a new practitioner. And in relation with the benefits, the majority of the students said that the program improved their problem-solving skills, their thinking abilities for differential diagnosis, and also give them more autonomy, more confidence for decision-making. We also performed a reliability and confirmatory factor analysis of the student answers for hypothesis generation and argumentation, and for knowledge application in clinical scenarios. And as you can see, we had evidence of an adequate reliability for the 3 dimensions and good validity based on the internal structure of Practicum Script. So the main conclusion of our study is that Practicum Script methodology is a valuable resource to be used by medical schools for the development of medical students' reasoning skills and to help them deal with uncertainty and complexity in their future practice, with good psychometric properties in terms of validity and reliability. Finally, I would like to mention that as a result of this study, right now there are medical schools in different countries which are incorporating Practicum Script in their curricular plan. If anyone is interested or has any question, here is my email address and the website for more information. Thanks for your attention.